Hello, I'm Dr. Stephen Roman. This talk is entitled, What is the Evidence for Fat Grafting in Fat Pad Atrophy of the Foot? A review of the clinical literature. Atrophy, or thinning of the fat pads in the foot, can occur in the forefoot or at the heel. This can be a debilitating condition. Some patients say that it feels like they're walking on bone. Contributing factors include age, weight, steroid injections, diabetes, and abnormal foot mechanics. Current treatments, including manual therapy, exercise, and orthotics, have shown limited success. Most of the research on this topic has been performed by Drs. Jeff and Beth Gusinoff and their colleagues in Pittsburgh. Gusinoff and others performed the first randomized controlled trial on fat grafting for fat pad atrophy of the forefoot. The treatment group of 13 patients was injected with their own fat, which was obtained via a mini liposuction procedure. The control group of 12 patients had standard care. Foot pain was measured by the Manchester Foot and Disability Index. Tissue thickness was measured by ultrasound, and foot force and pressure were also measured. At about 1 year follow-up, the treatment group showed significant improvement compared to the control group in pain and disability scores, and showed protection against worsening of foot pressures and forces. Mintier and others in 2018 published a randomized controlled trial on patients with foot pain under the heads of the metatarsals. This was a crossover study where 18 patients were assigned to autologous fat grafting, and the control group of 14 patients was treated with standard care for 1 year. Then, they too were treated with fat grafting at 1 year. Patients were followed for 2 years. Pain and disability were measured by the Manchester Foot and Disability Index. Tissue thickness was measured via ultrasound. Stance and gait force pressure were also measured. Pain and function scores remained improved over the course of the study in both groups after treatment with autologous fat grafting. This improvement occurred despite the increase in thickness of the tissue being temporary, lasting less than 6 months. Lower pain levels correlated to more normalized foot pressures, indicating that as subjects heal, their gait becomes more normal. Does skin quality determine foot pain? Farber and others in 2019 looked at skin quality in a randomized controlled study on fat grafting in patients with fat pad atrophy of the forefoot. 23 patients were split into a treatment group undergoing autologous fat grafting and a control group treated with conservative management. After 1 year, the control group then underwent fat grafting as well, and patients were followed for 2 years. After grafting, pain improved, and although fat pad thickness returned to baseline within several months, skin thickness remained increased throughout the study, which may account for continued pain relief. What about fat volume after pedal fat grafting? Ruan and others in 2019 looked at retained fat volume after grafting in a prospective study on 17 patients with fat pad atrophy of the forefoot. In this study, pain and foot pressures improved, and although fat pad thickness, as measured by ultrasound, decreased over time, MRI demonstrated that the volume of fat remained and was redistributed around the metatarsal heads. The studies we've reviewed thus far have been on fat pad atrophy of the forefoot. What about fat pad grafting at the heel? Preliminary findings from a randomized controlled trial looking at fat grafting at the heel pad have been published in abstract form. The treatment group of 7 patients who underwent fat pad grafting at the heel were compared to a control group of 5 patients that had standard care. At 6 months follow-up, the treatment group had scored better in foot pain and appearance, as well as fat pad thickness and foot pressures. In conclusion, in autologous fat grafting of the foot, pain relief does not appear to be directly related to increased fat pad thickness, rather more attributable to retained fat and improved skin thickness. No serious side effects occurred in any of the studies in this review. Autologous fat grafting is a promising therapy for symptomatic fat pad atrophy of the foot, with 3 randomized controlled trials showing favorable results in the forefoot and 1 randomized controlled trial showing favorable preliminary results in the heel. Thank you.